Guys, good afternoon. Can you hear me? Hey guys, good afternoon. Can you hear me? Okay, I hope you all had a exam, really good exam yesterday, right? And those who are going to take the FMGE in future, this is kind of a recall session. Though this was not a perfect recall I had with few of the students yesterday, they were tired, exhausted, and they couldn't even remember. So in this session, I have few questions based upon what they could tell me, but I am definitely needing your help to tell me in detail if you have any in other for like inputs for your juniors or your friends who are going to take the FMGE. So please keep telling me in the chat box what were the options, what were the other questions, or like leave a message in the Telegram group or in the comment box on the YouTube itself. Okay, that would be a great help. That is going to be a great help for the other students as well. Okay, myself, Dr. Varsha, I'll be taking the biochemistry session, recall session for the FMGE and on the behalf of eGurukul DBMCI. Okay, so this question is, I guess, a favorite for the FMGE examiners. They always keep asking about the Kazal's necklace, right? The Kazal's necklace. Almost every year we see this question, and that is because of which vitamin deficiency. Were these the options? First of all, the niacin, copper, iron, selenium. Hey, Pradeep. Hey, Thai body, Thai health. Okay, that's really a nice, catchy name, right? So, can you tell me what were the other options? Yeah, definitely the correct option was the niacin, and we have done that in the class as well, right? So, what these were the other options? The copper, iron, selenium, or something else was given to you? Right, keep writing in the chat box, right? And from the notes, right, those there were many students who were asking me when we will have the third version. Biochemistry 3.0 is now, right, available at the DBMCI. Those who want to take it, there are so many new things added to it, right? So this is from my notes, and we have done this about the niacin in the class, right? That is with vitamin B3, right? And vitamin B3 is one of the atypical vitamins. Atypical vitamins in the sense we make it from the amino acid. What amino acid? From the amino acid tryptophan. Okay, tryptophan has various pathways. It is an essential amino acid. It is an essential amino acid. From tryptophan, alanine can be synthesized, and from alanine we know we can synthesize pyruvate. Okay, and from tryptophan we can synthesize acetyl CoA, right? We don't have to know the details, just I'm going like quickly telling you the overview of the tryptophan, right? Tryptophan also helps in the synthesis of the nicotinic acid. And what is nicotinic acid? Nicotinic is none other than your niacin, right? And there is one more pathway with the tryptophan. Tryptophan can be taken to synthesize serotonin. Serotonin, right? And from the serotonin we synthesize melatonin, right? And this is not same as the melanin, but these are the serotonin and the melatonin, right? And there is an increased level of serotonins and the melatonin synthesis where in the carcinoid tumor, right? So in case the person is having this tumor, tryptophan is sucked towards the formation of the serotonin, increasing the serotonin levels. In that case scenario, there is less tryptophan available for the niacin. That decreases the niacin in the body, and that gives this Kazal's necklace, right? Or we can say decreased niacin gives you the also the pellagra like conditions. three Ds we talk about, right? The dementia, the diarrhea, right? Dementia and diarrhea and all that, and we have done that. Like many pictures I have given you there, you can have this kind of necklace thing also around the neck, and these also, right? There are various other things. I have given you the other alternative names of the vitamin B3, the niacin, nicotinamide, anti-black tongue factor, we also call it nicotinic acid, and it is also known as vitamin P earlier. Why? Because it has a, it in the, like in the previous times it was used for the as a preventive factor for the pellagra. That was earlier times when we used to call it vitamin P also, right? And those who are on the maize and the sorghums, they eat the maize and the sorghum for the prolonged period of the time, right? Then those people, they also have the less of the niacin, because there is this amino acid leucine, right, which interferes in the metabolism of the tryptophan, right? And for the future, not just for the recall, we should be knowing that from 60 milligram tryptophan, 1 milligram niacin can be synthesized in the body. Usually this is another high yield talk question about the ADP's ribosylation. So these are the various pictures of the Cazals necklace I have shown you in the class, right? Pellagra is your 3Ds or the 4Ds, the diarrhea, the dementia, dermatitis, and finally, if not cured, it can lead to death, right? And I am pretty sure there was another question, right? Somebody told me there was question about the HIAA, hydroxyindole acetic acid. Hydroxyindole acetic acid. Can you tell me what was the question related to this? Whether the hydroxyindole acetic acid levels were up or low. See, hydroxyindole acetic acid, as I have told you above also, tryptophan can be converted into the serotonin, right? And most of it is consumed towards the formation of the serotonin in the carcinoid syndrome, right? And serotonin, one of the metabolites of the serotonin is 5-hydroxyindole acetic acid. So in order to confirm the carcinoid syndrome, what we check the 5-HIAA levels in the body, and that test is known as 5-hydroxyindole acetic acid, right? Usually the normal levels of the 5-hydroxyindole acetic acid in the body is approximately from 2 to 5 milligram. Like our body makes this metabolite per day, or you can say for 24 hours. In the carcinoid syndrome, this is more than 25 milligram per 24 hours, right? That is indicative of the carcinoid syndrome, right? So HIAA levels are really up in the carcinoid syndrome. If this was the question, then you should have picked the carcinoid syndrome. But there are conditions in which the 5-HIAA levels are really, really low, right? Was this the question? Can somebody tell me, was this the question? If there is in the cerebrospinal fluid, if these levels are very, very low, that leads to very aggressive behavior. That is leading to the aggressive behavior, or maybe the suicidal thoughts, or maybe the suicide with the violent actions, with violence. If it was low, that should be the option. If HIAA level are high, then it is leading to the carcinoid syndrome. Okay. Now there was this another question. In the child presents with complaints of urine turning black upon standing. Urine turning black upon standing. This is one of another favorite question from the examiners, right? So when it happens, urine turns black on standing, right? कब होता है ये? We all know that. That is because of which? George, you're right. That is alkaptonuria. Yes, Christina. Divya, right? That is alkaptonuria. Very right. Okay, so there can be another options also, but whenever we are talking about the urine turnings black, then we are definitely talking about the alkaptonuria, and that this is what we know from the class also. The amino acid, we have three aromatic amino acid: the phenylalanine, tyrosine, tryptophan. Okay, tryptophan and the phenylalanine is are the essential amino acid. This is the essential amino acid. Why? Because the tyrosine, the another amino acid, can be synthesized from it. So it is not necessary that we consume tyrosine in our diet, right? And what is the difference? There is just a difference between phenylalanine and tyrosine is that tyrosine has one hydroxyl group, and that hydroxyl group is added by phenyl hydroxylase enzyme, right? If this enzyme is absent, that leads to the phenyl ketone urea, but that do not lead to the urine turning black. What is leading to the urine turning black? We have to kind of start from the tyrosine metabolism. So we are just now looking at the perspective from the tyrosine metabolism ka, okay? From the tyrosine, like when we metabolize the tyrosine, it gets converted into 4-hydroxyphenyl pyruvate. Then it gets converted into homogentisic acid. Homogentisic acid gets converted into melyl acetoacetate. Then it can get converted into fumarate, succinyl acetoacetate, succinyl acetone. Do you have to know all the steps? No, you don't have to know all the steps. This is just to tell you. What we have to know is the homogentisic acid. Okay, the homogentisic acid gets converted into melyl acetoacetate, and the enzyme there is homogentisate oxidase, also known as homogentisate dioxygenase. Sometimes they trick you by giving an option homogentisate dehydrogenase. I have seen that in many previous recall, but that is not dehydrogenase. You have to keep in mind it is either oxidase or dioxygenase. Previously we called it as oxidase, but in fact in like practical aspect it is dioxygenase. Okay, so that will, if this enzyme is deficient, that will lead to the accumulation of homogentisic acid. And this homogentisic acid, when it is like in large quantity, they are going to make polymers with each other, they are going to stick with each other. That is going to lead to the blackening of the urine, or making the ochronosis that we call it, right? Like black pigmentation here on the skin, also even in the eyes. That is because of the polymerization of the homogentisic acid, right? And that we have done in the class also, right? This is our notes. We always talk about homogentisic acid getting converted into methyl acetoacetate. Enzyme required is homogentisic acid dioxygenase, right? And then we talked about the alkaptonuria. If this enzyme is deficient, the green highlighted homogentisic acid is going to be accumulated, right? And this accumulation will lead to the polymerization, that is benzoquinone acetate. Not really, you don't have to know the name, you have to know the homogentisic acid, and the enzyme is homogentisate oxidase. That polymerizes, that leads to the black skin condition, right? Black skin condition. And these are the black skin conditions we see in the eyes, right? In the ears, and the urine turns black upon the standing, right? Usually it is asymptomatic in the childhood. But what happens next? This is, you should be knowing, in the childhood usually the urine is black, but since we pee in the washroom, we flush it out, we really do not notice it. Development is normal. But around in late like 30s or early 40s, we tend to notice it because the patient experience erosive arthritis, back pain and stiffness, and ochronosis. Ochronosis is what the term given for the black pigmentation of the skin, such as the tip of the nose, earlobes, elbow, knee, skin over tibia, right? In the babies, if you carefully look, we can really catch this alkaptonuria at that point in time if the diapers are closely washed for the sand like crystals. Okay, and this is the mnemonic which I have made for you, that Alka came home, saw black bug, shouted, "Oh!" Alka, alkaptonuria, black is blackening of urine, O is ochronosis, right? That what we see. And remember, that is also related to the stiffening of the bag. If actually what I was talking to one of the student yesterday, and he was telling me, ma'am, most of the questions this time in the biochemistry were the clinical oriented questions, right? So they are not going to give you the direct, though I have, he couldn't remember what was the entire clinical case scenario. He could just vaguely tell me, okay ma'am, the question was all about the blackening of the urine, so I picked that word. But I am giving you the entire theory behind it so that you can make it out. You can really see the question, blackening of the urine with stiffening back, maybe the ochronosis. These are the keywords you have to look for in the even in the clinical case scenarios. Okay. Nagaraja said, "Hello, ma'am. Urine turning black diagnosis wasn't asked. The question was enzyme deficiency. Homogentisate oxidase was answer." Okay, so enzyme deficiency, they were asking you that, what you mean, right, Nagaraja? That means they are telling, they are giving you alkaptonuria disease, and they were asking you about what was the enzyme defect, right? Okay, so enzyme defect is homogentisate oxidase. That answers you, right? Okay, the Soumya says the question was not child, it was adult. Okay, okay. So if I have to reframe the questions, which I'm going to do it later and post it. So there was no child, but there was adult, right, who was suffering from alkaptonuria, and the question was asking you about what is the enzyme effect. Am I right now? Right? So enzyme defect would be homogentisate oxidase. Can you tell me another enzymes names that were given as an options to you? So one is your answer, homogentisate oxidase. कोई और options were there so that I can fill in and reframe the question? See, if there can be one phenyl hydroxylase, that's why I always try to give you a theory behind it. So here I have told you one phenyl hydroxylase, but that is not leading to alkaptonuria, that is leading to the phenyl ketone urea, right? So that might be another options. Usually the way I look at the recall questions is, I want to know what was the topic. Okay, if I know a topic or a subtopic, and if I learn everything around that subtopic or a topic, right, so I'm better prepared to take the exam, because in the next question, in the next exam, you are not going to go see the exactly same question, but from that relevant topic itself. So we should be knowing the entire theory, and usually that is my purpose for the recall questions. Taking a recall questions, I need to know what was the important topic from where the question has been asked from. So question was asked from alkaptonuria, and so I have given you the entire theory, right? Okay, Divya Raj, there was this another question. Yeah, I have that question, but there was a question about the complex 4 inhibitor of the electron transport chain. Is that right? Was there any question? We know that electron transport chain has 5 complexes. complex 1, complex 2, complex 3, complex 4, complex 5. I don't know the exact question, but if you can tell me. So they were asking you the inhibitor for the complex 4. Complex 4 is cytochrome oxidase, right? CO. So carbon monoxide, cyanide, hydrogen sulfide, all these gases are inhibitors for the complex 4. This question wasn't asked, Kabir? Okay. Then maybe there was question similar to this and the student was confused. Okay, let's move into next question. Okay, we have discussed this in the PYQs also, electron transport chain, and also the various important topics, right? There was question about the hydroxyindole acetic acid in the urine, which I have described above also. And the hydroxyindole acetic levels are high. If this was the question, then answer was the carcinoid syndrome. Right? And we have done this in the class also, and I have given you this in the notes also. In the tryptophan, right? Most of the tryptophan is taken towards the formation of the serotonin, right? That will lead to the increased serotonin levels, right? And which can be tested if we detect the 5-hydroxyindole acetic acid. Kartik Gupta, if it is low, right? I have told you above also, if the low levels of hydroxyindole acetic acid, what I know is, if we check it in the cerebrospinal fluid, if the HIAA levels are very, very low, right, then the normal. So that is responsible for the aggressive behavior and the suicide by the violent means. And there are one more important interesting fact is the increased level of HIAA is found in the patients who are autistic. If low, aggression, suicidal thoughts. And I guess the medicine faculty or maybe the psychiatry professor, he can tell you much better than that. And low levels can also indicate, if you think in the term of the tryptophan, that tryptophan is not available, right? When the tryptophan, you don't have the tryptophan, much of the tryptophan available, right? Much of the tryptophan is not available. You cannot make the serotonin. Definitely HIA levels are going to be low when you don't have the tryptophan. Tryptophan is an essential amino acid. When the absorption is impaired, right? And when that happens in the Hartnupp's disease, the transporters of the intestine and the kidneys, they are not working properly, leading to the tryptophan deficiency. And then we see the HIA levels. If we detect that HIA levels, that means the Hartnupp's disease. In the Hartnup disease में क्या होगा? The HIA levels should be low. But that depends what was given in the question. Right? If it is not absorbed properly, the other way to detect it is in the babies is via in the babies who are having the blue diaper baby syndrome. They don't have their tryptophan is not absorbed properly, but it comes as such and it is degraded in the system because of the formation of the indole or indigo blue. The diapers are blue for the babies. Kartik, does that answer you? Does this answer satisfies you? Okay. Now there was this question about the elevated uric acid level. Was this the question, or somebody can help me to reframe the question? What I know is the uric acid levels were raised, and this is again a very well, like every time they ask you about this question, the serum uric acid or the urine levels, uric acid levels are higher, right? Which medicine, if let's say a patient has the uric acid really high uric acid levels, so which enzyme should be inhibited, which medicine should be given, and that medicine inhibits which enzyme? We should know all of those things. What makes the uric acid? Xanthine oxidase. Thymidylate synthase. Thymidylate synthase name is indicating we are talking about the pyrimidines. Pyrimidines is CUT, cut, right? So usually what happens is when we synthesize the pyrimidines, first we synthesize cytosine and uracil, and then the uracil is methylated, right? A methyl group is added so that it can form the thymine, okay? And that enzyme is thiamidylate synthase. That is related to the synthesis of the pyrimidine. It has nothing to do with the uric acid actually, right? Adenosine deaminase is about the deamination of the purines, okay? So if I have to make a picture, let's talk about the deamination of the purines. Purines are what? Pure as gold. So you have, let's say, AMP and the GMP, and we are talking about the catabolism or degradation, right? AMP, first what goes? Dephosphorylated, right? Phosphate is being removed. When the phosphate is being removed, this nucleotide become nucleoside, and what this nucleoside is called? This is called as adenosine. Okay, adenosine. Then what happens? Adenosine has amine group, so then it is deaminated. This is deaminated. Enzyme is adenosine deaminase, ADA, right? And then what you get? You get inosine. Okay, inosine is formed. Now inosine do not have the amine group. Then what we remove? Then we remove the sugar, the ribose 5-phosphate, right? And the enzyme is PNP. What is PNP? PNP is purine nucleoside phosphorylase, right? Finally, what you are left with? You are left with hypoxanthine. That is how we degrade the AMP. And the GMP, how do we degrade the GMP? Similar to the above GMP, maybe we are going to remove the phosphate group. You are left with guanosine. But guanosine do not have the amine group, so you skip that part, right? And PNP acts upon it, make ribose 5-phosphate go away, and you are left with what? You are left with a base, that is guanine only. That is guanine. Guanine as a base, right? Now these have two fates. Either we can use them for the salvage pathway. Salvage pathway is resynthesis of the purine, or we can take them for the degradation. We can take them for the degradation. Both of them are converted into xanthine first, and this xanthine will be converted into uric acid, and the enzyme involved is xanthine amino oxidase. So if those patients who have the increased uric acid level, ठीक है, जिनका uric acid level is really increased, we need to inhibit this enzyme xanthine oxidase, and that is done by a purine analog, allopurinol, right? Yes, Medico Corner, right? Allopurinol is what? It is a purine analog. It inhibits this enzyme, thereby helping us to decrease the or maintain the uric acid level, right? So answer to this is xanthine oxidase. HGPRTase, why this is not HGPRTase? If we take both of them, hypoxanthine and guanine, via the salvage pathway, then this enzyme HGPRT helps us to resynthesize purine. Helps us to resynthesize purine. I'm not going in detail, right? And if this enzyme is deficient, what do we see in HGPRTase? Definitely there is elevated uric acid, but what is the biggest thing that we see? This is self-mutilation shown by the patient suffering from the disease, and that is Lesch-Nyhan syndrome. Okay, if the uric acid levels are increased, right, and the self-mutilation is seen, right, spastic cerebral palsy is there, then we can say HGPRT ka deficiency was there, right? So this is not a choice. Adenosine deaminase, you should see something about B cell or T cell, which is not given, so this cannot be a choice, right? Thymidylate synthesis is about the pyrimidine, like thymine synthesis. So answer to this is this, right? Do you know any other diseases, deficiency diseases, in which the uric acid levels are up? You should figure that out. In which, under what conditions the uric acid levels are elevated? Galactosemia, uric acid levels are high, right? And when you have what? Hereditary fructose intolerance, enzyme is aldolase B, uric acid levels are high, right? Here, the xanthine amino oxidase, right? Uric acid levels are high. Now, there was another question which somebody asked me, when you have the uric acid level, right, really, really high, that in those patients, why there is lactic acidosis, right? That is another very important thing. See, the lactic acidosis and this uric acid, when they have to be removed from the body, they have just one exit gate, right, in your renal tubules. Either lactic acid can go or the uric acid can go, right? So when you have to eliminate the uric acid gets the preference, so lactic acid stays in place. That leads to the increased level of the lactic acid, leading to the lactic acidosis, because they have just one exit gate for both of them. They share the exit. Okay, why I have this is just to tell you that we have covered this in the class. Allopurinol eliminates the increased uric acid condition, so definitely my students have gotten this question right. Question number 6, which vitamin deficiency bite or spot? This was the question asked in the NEET PG also. Was this the question? Which vitamin deficiency leads to this? A, B, C, K, we know that is vitamin A. Bite or spots, right? When we talked about the vitamin A in the class also, in the notes also, the deficiency symptoms of the vitamin A, what did we study? We studied initially the earlier signs is the loss of sensitivity to the green light, but with the time there is the bite or spots, right? Or you can say xerophthalmia is there, right? Okay, now this is the question. Divya was telling, right? Which vitamin deficiency causes tingling sensations, right? Pallor, ataxia. Were options were riboflavin, niacin. So this is thiamine. Right, this is riboflavin, folic acid, right? Oh, vitamin A was not there, so it was riboflavin. Riboflavin was there. This was the question, right, Divya? So what can be the answer? Tingling sensation, pallor, ataxia. Usually whenever we talk about the tingling sensation, we always look for vitamin B12, right? Tingling sensation in the hands and the feet and the face also, right? Because of the problem with the nerve conduction, because of the vitamin deficiency. Ankit, pick one, A or C. Riboflavin or the folic acid. BBB. Anonymous person says BBB, thiamine deficiency. See, whenever you have the tingling sensation, first choice is vitamin B12. If it is not given to you, then the second choice would be the folate deficiency. Then vitamin D also causes the tingling sensation. And the last, not the least, vitamin C you can pick, right? But you had vitamin B ke baad what you had the folic acid. So if nothing else was given, I will pick the folic acid, the ataxia and the pallor. But if you have more details, you can tell me. Divya, you told me this question. Do you have more information? Otherwise, if you have more question, I just know there was some question about maybe the glucagon level or the glycogen level in the body, but nobody could recall it, so I have not included that question in this recall session. So if you know that question, like, I'll really request you, please share those questions. That will be a great help for the other students, right? So that is that will be a really act of kindness for you, that you are helping other students who are pursuing for the FMGE exam. So if you have any other questions, please, 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 humble request from my side, please kindly share it in this also, in the comments box also, or leave a message with me at my Telegram group. See, all these are like donations. Whatever you questions you are sharing with us, these are like kind of a donations. You are doing something for a good cause, so that other students may pass the exam, right? So please do that, and I wish you a very good luck. Just don't be anxious, stay calm, stay cool, don't take too much of the break. Like, yes, today is gone, enjoy today, maybe tomorrow then get back to your work, start doing practices or learn something. If you have other aims, work for it. Do not waste time. Every day, single day counts. So every day do a little bit, not too much, but do something that should add on to your knowledge or your personality also. Okay, with this, I'll say thank you for listening me, and please keep sharing the questions. Thank you very much.